Welcome back to 5 News. Now imagine being diagnosed with a medical condition and prescribed a treatment only to find you can't actually get your hands on the medication you need.
Well, that's the reality for some patients living with attention deficit hyperactivity disorder, also known as ADHD, due to manufacturing issues and an increased global demand. And it seems there's no quick fix, with the government saying that some supply shortages could last until December.
Well, Ruth Liptrod has been speaking to one person impacted, and her report contains some upsetting details.
Impulsive, creative, inattentive, at times debilitating, passionate. ADHD.
Jacob was diagnosed with ADHD when he was 14 and has been on medication for 20 years to manage his symptoms. He's a dad and has a high-pressure job in NHS mental health. Right now, though, there's a medication shortage and he's got about 3 weeks left on his tablets. This is what he's worried about if he runs out.
Worst case scenario, highly suicidal and left out of a job and married. Without meds, it puts a massive risk to my own mental health and well-being.
5 ways to tell if you're neurodivergent.
So what's going on? Well, it's true that increased awareness and diagnosis of ADHD has led to a higher demand. It feels like everybody's talking about it at the moment, but it's more than that.
There's a completely devastating shortage of ADHD medication because there's been a problem in the manufacturing. The UK is supplied by a factory in Southern Ireland, and there's been a failure there. But the true failure is that there have been no NHS stock guidance on this at all.
The government says it's aware of the shortage and is working with manufacturers and NHS providers to get the issue sorted, but it won't be fixed before December. Part of the problem is that pharmacists can't deviate from the prescription. So if a patient needs 50 milligrams of medication, but the pharmacy can only get hold of it in 20 or 30 milligram form, they wouldn't be allowed to give it without the patient getting a new prescription from the GP, even though the total dose would be the same. At this pharmacy, they're doing their best, and that often means ringing around until they can get their hands on the right meds.
Some patients will have to have a conversation with their GP, but the key thing is to say, we will be doing our best for you. Please don't get anxious. Also, don't try and start stockpiling the medication, because that just makes a difficult situation even worse.
And don't leave it to the last minute. Talk to your GP or pharmacist well before you run out.
Can you describe what it feels like, ADHD? What does it feel like inside your brain?
Someone described it as it's like driving a Ferrari with bike brakes. So it's like your brain is just so busy, you can make these really impulsive decisions and then quickly regret them.
Those ADHD meds are essentially there to be the brakes on that Ferrari, and no one would expect a Ferrari to have to drive without them. Ruth Liptrot, 5 News.
More headlines now.